Good evening, doctors. Today we are going to discuss about psychiatry questions. Question 8 is hallucination is a disorder of, it's a perception disorder. Okay. Which is not a perceptional disorder. Question 10th. Delusion is a thought disorder. Otherwise, that's why delusion is not a perception disorder. Okay. Another question we are going to discuss. Question number 42. Erotomania is seen in a bipolar mania. Okay. Now, another questions we are going to discuss here. Important. Folle dukes means 88 question. Folle dukes means sharing of delusion. 88 is B. Okay. Quad hank means answer here is D. Male important to a particular woman. ID ego superego terms coined by answer here is Sigmund Freud. Ataxia aphasia is seen in question number 91. Conversion disorder. Question number 92. Pavlov's experiment is an example of classical conditioning. Question number 93. Logged in state associated with answer here is pons. Suicide is most common in here answer is depression. A1. Suicide most common in depression. Total score in minimal mental status examination is answer here is 30. Okay. Doppelganger's is Doppelganger is feeling of doubles of oneself. B answer 97th. Which of the following is a delusion? Delusion here is Othello's syndrome 98A. The time interval between the acute and persistent psychotic disease is 99. Answer here is 1 month. Definition of hallucination is perception without stimulus. A answer is right. Modern psychiatry father is Pineal, Pineal 101. Capgras is sharing of delusion. No, Capgras is delusion of double. It's known as Capgras. In stupor, catatonia, all are seen except agitation. We are not going to see. Features of delirium is altered sleep, autonomic disturbances, disorientation, and D. All is the answer, right? Delusions are feature of all except 105. In OCD, we are not going to see delusion. Again, question hallucination true is hallucination. There is no external stimulus. So C answer. Cotard syndrome has nihilistic delusion is C. Okay. Visual hallucination are seen in all except in depression. We are not going to see visual hallucination. B is answer. Term psychiatry was coined by John Rale. B is answer. Hypnagogic hallucination seen in gogic going to sleep. Narcolepsy in sleep. Answer C. Cancer syndrome is a feature of dissociative disorder. Repetitive, irresistible thought to do something is to do something only thought is obsession. Formication is seen with answer here is chronic use of amphetamines. B. Magnon syndrome is a tactile hallucination. Magnon syndrome is tactile. D answer. C with cocaine also. Predisposing factor for suicide are all except yes, depression, drug abuse, yes, living alone, single, yes, but female sex is not predisposing factor for suicide. Okay. 121. True about delirium are all except preserved attention, This preserved retention is wrong. A answer. Now, question number 134. Subcortical dementia seen in all except not seen in Alzheimer's disease. B answer. Now the question 165. All associated with Wernicke's encephalopathy except is cogwheel rigidity. A answer. Okay. 168. Wernicke's encephalopathy features are all except ataxia. We see aphasia, nystagmus, and confusion. So aphasia we are not going to see in Wernicke's encephalopathy. That is, yeah. Another question. Wernicke's encephalopathy is due to deficiency of thymine. A answer. 207. 208. Classical trait of global confusion ataxia ophthalmoplegia is seen in Wernicke's encephalopathy. C. 208C. Repressed information can be brought into conscious mind by all except dreams. Yes, we can. Focused attention, somatic stimulation, hypnosis. By focused attention, we can't do this. So answer here is focused attention. B. 209. IQ of 15 is a grade of mental retardation. IQ 15 is profound. D is answer. 210. Okay. All are reversible causes of dementia except we already seen 211. Answer here is D. Alzheimer's disease. Neurotransmitter playing important part pathogenesis of Alzheimer's disease is acetylcholine. 212. C answer. Okay. Now, which of the following is explicit memory? Explicit memory is semantic. C. All are feature of neurosis except 214. Contact with reality preserved. Yes. Personality disturbances. Insight is maintained. Symptom cause active distress. Personality disturbances here is answer 214. Differentiating feature of dementia and delirium is impaired consciousness is the answer here. C. 215. Treatment of Wernicke's encephalopathy includes answer here is thiamine. B. The term dementia precox was coined by here answer is Kraepelin. C. IQ of severe mental retardation is 20 to 35. Here answer C. 218. Short term and long term memory processing is done in answer here is B. Hippocampus. So remember. Okay, next question. Most commonly abused opioid is diacetylmorphine. B. 227. Answer here is B. Okay, 248. Delirium is seen in tremens seen in alcohol withdrawal. A answer. Another question. 249. True about delirium tremens, clouding of consciousness, course of tremors, chronic delirious behavior, and hallucination, autonomic dysfunction. So if we see 249, we no need to, it's PGI, not Neet. Okay. Another question. 273. Hangover following alcohol consumption can be treated with thiamine. B. Okay. Question number 292. Etheromania refers to it's an ether addiction. B. Okay. 303. False regarding delirium tremens is tremors. Yes. Ophthalmoplegia. No ophthalmoplegia and delirium tremens. B is answer. Korsakoff psychosis is A. Thiamine deficiency. Which of the following can cause delirium? Yes, hypoxia, barbiturates, alcohol withdrawal, and D. All answer is right. All D. A patient is a non-alcoholic since last 20 years. Suddenly he develops raised tremors, agitation. Diagnosis is delirium tremens. Permissible blood alcohol level during driving in India is 30%. 307 answer here is B. Now, drug used for cocaine withdrawal symptom is there is no drug for cocaine withdrawal symptom. Okay. 309 a patient on alcohol dependence was given a drug and avoid alcohol as drug interaction would lead the adverse drug reaction with 309 answer here is disulfiram. A role of marijuana in AIDS related cachexia is it increases appetite. C 310. Okay, 311. All are seen in nicotinic withdrawal except hyperhidrosis. We are not going to see. Okay, 312 question. All are features of Korsakoff psychosis except here is ataxia. Okay. Diagnostic criteria for drug dependence include all except tolerance, yes, withdrawal symptoms, yes, larger dose than usual, yes, but no early completion of task. 313. 314. Earliest symptom showing improvement from classical vernicals encephalopathy to thiamine therapy is 314. It's ophthalmoplegia. Okay, right answer again. All are symptom of morphine withdrawal except fall in BP. Except okay. D. Drug used for cocaine withdrawal symptom is no drug. All are used for treatment of morphine dependence except for morphine dependence we are not going to use disulfiram T. All are anti-craving agent for alcohol except lorazepam A. 318. Drug of choice for substitution therapy in morphine is A. It's methadone. 319. All are seen in nicotine withdrawal except A. It's hyperhidrosis. Drug of choice to treat delirium tremens is diazepam. 321. Okay. Now, the term dementia precox was coined by Kraepelin. We already discussed this question. Term schizophrenia was coined by Bleuler. C is answer. 337. Okay. Another question. First ranked symptom of schizophrenia are all except A answer. Ambivalence. 352. 353. Which of the following is not considered a first ranked symptom of schizophrenia? Auditory hallucination, yes. Insult of thought, delusion of persecution, compulsive act, relieve the tension. If D is the wrong answer, so D is answer here is right. Not they are, that's why D is answer. Sherender first rank symptom in schizophrenia is audible thoughts, guys. A is the answer. 351. Okay. Now another question. 394. Type of schizophrenia with mental retardation is D. Puff of schizophrenia. 401. Good prognosis in schizophrenia indicated by soft neurological sign, affective symptoms, emotional blunting, insidious onset. It's affective symptoms. Okay. Acute and transient psychotic onset symptom is less than 2 weeks. B. 456. Delusion which involves replacement of familiar person by someone else is Cotard syndrome. No. 257 is Capgras syndrome. Prognosis of schizophrenia depends on 258. Emotional flattening. 259. Schizophrenia is more common in which socioeconomic status? C. Low status. Good prognostic factor for schizophrenia is presence of depression. C. 460. Poor prognostic factor for schizophrenia is D. Its early onset. Schindler first rank symptom is audible thoughts. C. 462. Schizophrenia result with increase in dopaminergic activity. C. Waxy flexibility is a feature of 464. Catatonia. All are feature of psychosis except presence of delusion. Yes. Preserved contact with reality. C is the answer. It's all false. Blue symptoms for schizophrenia are all except it's hallucination except answer. Now 467. All are used for schizophrenia except chlorpromazine we use, but venlafaxine we are not going to use. Negative symptoms of schizophrenia is C. Ambivalence. 468. All are diagnostic symptom of schizophrenia except 469 is D. Social withdrawal. All are true about type 1 schizophrenia except negative symptoms. 70-year male utters same answer to all question. He is suffering from organic brain disease or schizophrenia both, but go for organic brain disease in exam. 17-year-old schizophrenia recently started on antipsychotic board to casualty with neck rigidity. He has dystonia. A. Bad prognostic sign of schizophrenia is negative symptoms. Okay. DSH4 criteria for depression is 484. B. 2 weeks. Suicidal tendencies are least common with married person. D. Answer 501. Okay. Depression, there is a deficiency of 5-HT. Okay. $561. Drug of choice for bipolar mood disorder is lithium carbonate. 561B answer. The maximum daily loss is for following disease. It's for unipolar depression B. Phobia is defined as it's excessive unreasonable fear about a specific situation. B is the answer. Anxiety is neurosis is the answer. 582. 30-year female with depressed mood, decreased appetite and no interest since last 1 year. Diagnosis is depression B. Treatment of resistant depression is ECT, it's electroconvulsive therapy. A is the answer. For diagnosis of mania, symptoms should be more than 1 week. A is the answer. 18-year-old girl with circumscribed bald patch with no organic disease and no behavior disorder has trichotillomania. She is pulling hair, that's why she has bald patch. Pyromania refers to an irresistible urge to set things on fire. A is the answer. Treatment of unipolar depression is all sertraline, fluoxetine, citalopram, all D. Pathognomonic manic episode is grandiosity. B. Trichotillomania is irresistible desire to or compulsive hair pulling. We can say C is the answer. Treatment of choice for rapid cycles in bipolar disorder is C is valproate. Neurotransmitter in mania is increased norepinephrine. Okay. 592. Which of the following is a atypical antidepressant? It's C, venlafaxine. 592. All are required for diagnosis of major depression except it's major depression except 593 is C, nihilistic ideas. Classical traits symptom of depression include all except depressed moodiness, slow thinking, distractibility, psychomotor retardation. Here answer is distractibility. C. Cyclothymia is a type of Cyclothymia is a type of 595 D. Persistent mood disorder. A young lady lost her job, lost appetite, wakes up 3 a.m. What is the diagnosis? Its diagnosis is depression. 18-year male, flat affect, odd behavior. Diagnosis is it's schizoid personality disorder. D. Endocrine disorder associated with depression are all except here is pheochromocytoma C. 598 C. All symptoms include the diagnostic criteria of major depression except early morning awakening. Except answer here is D. 599. Okay. 689 question. Not used for erectile dysfunction is beta blocker. We are not going to use for erectile dysfunction. 690. A student unable to deliver speech before read audience is suffering from sociophobia. A. All are anxiety disorder except its conversion reaction. 691. Drug of choice for generalized anxiety is alprazolam B. Which of the following is a neurotic disorder? It's phobia. So guys, if you still not subscribe my channel, please don't forget to subscribe it, and it's the first part. Second part we are going to discuss in our next topic. Have a good day. Goodbye. Thank you.